Okay, so here we're going to do a TFL release. That stands for tensor fascial lata. So the tensor fascial lata is a muscle that kind of sits between the greater trochanter. So if you can find the bone on the side of your hip right there, and then your ASIS, which is a bone just kind of in the front of the hip, in the top portion of the pelvis there. So if you connect those two with your fingers, the area right in between, that soft area, that is the TFL. That muscle sort of flexes the hip, internally rotates the hip. You'll feel it contracting when you do that. A lot of times this muscle can get kind of gnarly, knotted up, and can start limiting hip rotation in general. So what we're going to do is place that tennis ball right on that spot. From here, I'm going to position myself laterally and then kind of work anteriorly now. So now I'm face down slightly right on that area. Now once I'm on that position, I want to try to find a tender spot. You might find there's a few of them, or it might just light you up right away. I got a tennis ball, so this is a little bit less intense. You may want to start there. Right there, I'm right on it. So from here, I'm just going to breathe and relax. Trying to get that muscle tone, that guarding to sort of let up a little bit so it's not so painful, maybe 45 seconds from now. Typically, we're going to hold this anywhere from 30 seconds to 120 seconds. Yeah, it never really feels that good. But a lot of times, this can be the source of knee pain, believe it or not. IT band syndrome is commonly associated with stiffness through that TFL or overactivity through that TFL. So tennis ball, lacrosse ball, a softball, something that's going to fit in that area. Foam roller may not work as well. Give that a shot. It's going to hurt a little bit, but it should feel good and should feel better afterwards.